Hello, everybody. How are y'all today? I'm Dr. Margaret Rutherford, and I am so glad to be with you today. It's really a special day for me. It's my 31st wedding anniversary today. I was going to play a game with my husband and see if he remembered because we're celebrating by going on a vacation on Friday, but so we're not doing anything today. But I decided that really wasn't fair. I hate when somebody in a couple plays a game and the other person doesn't know that they're being tested or they're being evaluated and they don't know about the game and so they fail the game. Anyway, that's a little couples therapy lecture there. I'm glad to be here and I've been doing Facebook lives for mental health on the mighty now 5 years and a couple of weeks. So I'm delighted. Well, I've said I'm delighted now about 4 times. I'm really happy to be here. This is a topic that's tough. Grieving suicide loss. And, this is Suicide Prevention Month. And so it might seem a little strange that we're going to be talking about grieving suicide loss when we're actually, of course, trying to prevent it. But the research shows that talking about suicide and then talking about some of the ramifications of suicide does not increase the risk of suicide. So we want to give you a chance to talk about whatever's on your heart and mind. I have some research findings, and I'd be more than happy to talk about them with you. I am a clinical psychologist. I'm out of Fayetteville, Arkansas. I've been here about 28 years, and I love doing this. It's one of my favorite things to do every month. And I'm usually here the third Wednesday of the month, unless there's some kind of weirdness. Hello, Jen. Hello, Anne. So glad that you're here. I'll keep on talking a little bit just to let people get on, and so I don't start something and then nobody knows what I'm talking about. I do have a podcast called the Self Work Podcast, and I have a book called Perfectly Hidden Depression. And actually, one of my concerns about perfectionism is that I know that it can act as camouflage for very well constructed camouflage for underlying despair and loneliness and even suicidal ideation or an actual suicide, and somebody who everybody thinks has the perfect looking life, and then all of a sudden they die by their own hand. And so I've been actually getting emails and contacts from people for years about my writing about that and my concern about it. And I know that happens, and that may have happened to some of you. Hello, James. Good afternoon. I lost a friend and former classmate who had committed suicide. Yeah. Um, and James, you use a term that has been used forever and ever and ever. A lot of the suicide advocates or people who fight for understanding of suicide ask us to not use that term because it feels like it's a crime of some kind. It's again very well used, but I just, for the sake of our conversation today, um, maybe we can try to refrain from using it. But when you have a friend, it's one thing for to hear of a stranger suicide, but then someone you knew and someone you think, I, maybe could I, when was the last time I talked with him, and what is, I wish he had reached out to me or something. It can lead to a lot of complex feelings. Let's hear from Amanda. I'm still grieving my sister who committed suicide almost 3 years ago. I find myself crying at random times of the day. I'm struggling with regret, being that I was depressed along with her and couldn't be of any help. If anything, I was snappy and closed off. I can still hear her voice and feel her hugs. The pain I feel in my heart is so heavy. I wonder how long I will feel this way. Goodness, Amanda, your experience is one that is very familiar to me because, of course, I've worked with many people through the years who had a sister or a daughter or a mother or, obviously males as well. Actually, males die by suicide more often, mainly because women attempt more, but men die more often because they use more lethal means typically. So I know exactly where you're coming from, um, and there's just no way around it. The model I have for grief with my own patients is to say something like this. Um, Grief is like you've never heard of an ocean, and someone picks you up and at midnight, and it's a black night. You can't see anything. There's no moonlight, and they sorry, I'm falling over my words today, and they put you on the beach at high tide, and the first wave hits you, and you don't know what it is, and you instinctively dig your toes into the water, and you fight the undertow, but you don't even know what an undertow is, and and then the next wave hits you, and then the next wave hits you, and what you don't know is that the tide is gradually going out. So you have to learn that and just have sort of a survival instinct. But at the same time, we all know who know anything about the ocean that occasionally there'll be a rogue wave, and that all of a sudden you will be hit by an even stronger wave than you were before. Um, so I think that when you have a situation where you've been struggling with your own depression, and that is something that your sister understood and wanted to comfort. I don't know how much she really talked to you. Most people who die by suicide don't just think about it that day. They've thought about it before. And I'm sure if she had said to you, "Yes, I'm thinking about killing myself," that would have been enough to say, "Well, you've got to get help. Let me help you." But that's not what she said. She served the role of comforting you, it sounds like. So she didn't want you to know. And, let me see, I think I need to pay some attention to Stephen. "I have no future, no hope. I wish I'd never been born. My mother had both bipolar and bodily and mentally abused me." Stephen, we're gonna have information here about how to reach out if you indeed are suicidal yourself. Um, that hopelessness, I will say to you, is one of the, major factors in people who die by suicide. So you can grieve, um you can you can find things about your family, and if your mother was mentally and emotionally and physically abusive, then there are treatments for that. There's EMDR, eye movement desensitization and reprocessing therapy, but also just normal talk therapy where you can have a relationship with someone who can help you disentangle a lot of that. But if you are hopeless, then that is something that I hope you will tell a local provider, and they can help you get help, because you do have to find some hope. Um, it is, you know, you don't want to feel like pain is unbearable or intolerable, because what you can forget, and this has been shown by the research and the literature, what people who are considering suicide don't realize is that perhaps the way they feels intolerable, but they sort of disconnect and detach from the realization that their life will end. There's going to be an end to life. Their pain will end, but so does their life. So, and suicide survivors, people who tried to attempt suicide and then and failed or didn't go through or whatever, will tell you, "I have discovered that I'm so glad I'm alive. I was distorting things in my own mind, and what I was seeing as unbearable was actually something that I just wasn't even looking for help. I wasn't open to help." And so I hope you do look for some help in your area, because it can make a huge difference. James, "I've always said that no one sees the clown cry." It makes sense. That's right, about the perfectly hidden depression. That's right. I'm not sure I've ever heard that particular phrase, but you're right. The person who's always making other people laugh, or the person who is a helping professional, or sadly, I've had parents who've buried their children, and their children didn't seem like they had any problems. There's a great book called What Made Maddie Run, and it's about a young college track star whose parents agreed to have her story told because she was young and she was beautiful and she was talented and she was smart. And what they didn't know was that she was looking up ways to kill herself on the internet, while at the same time running an Instagram feed that looked as if absolutely nothing was wrong. And so I love that phrase. I've not heard it, so I appreciate you offering it. And Stephen, looks like you're getting some support. Oh, you love the book. You love the "What Made Maddie Run" book. Yes, it's an excellent book. It's called "What Made Maddie Maddy Run," and it is a true statement that, again, we have to look beyond what someone looks like. I just got emailed about 2 months ago from a woman whose husband was like the leader. He could have won a generosity award in his community. He was known all over the city as the person to turn to if, there was a problem or you needed money raised or you needed help of some kind. He had been a very successful lawyer and he ran a nonprofit legal organization. And so he was doing good constantly. And the only thing that his wife said about him that might have been a small sign was that, he'd been drinking a little bit more. Never a big drinker, but that was really the only time he could relax. And so and he killed himself suddenly, and the whole town and community was shocked. And so that can happen. And at this point, I'm sure we all know people that, no one knows why what was going on in their mind and why they died by their own hand. Um, Amanda, you write back. Several of you are tagging other people. I'm so glad you are. Thank you for that. I've suffered from depression since I was a child. I've contemplated my death more than anyone should, and I'm still here. My sister is not. It makes it all the more harder that I miss her so much, but knowing that others feel the same way and understand what I'm feeling alleviates so much of the weight. I promise you it does. A wife comes to mind who they really never could figure out. They figured out that he had been acting secretively. There was money they couldn't find. There were texts that didn't make sense. Um, but he died by his own hand, and they had 2 children, and um, he had left sort of a note telling her not to blame herself, that he had something that, he had a secret that he was very ashamed of. And he even died in a way that the insurance went on and paid. You couldn't really tell for sure it was a suicide. So he felt as if, the money was worth more than he was or something. You can hear the irrationality of the thinking. And I have had people tell me so often that, um, the complex and very complicated feelings you have: anger, you have sadness, you have questions, so many questions. Um, what could I have done? Was I not important enough to them for them to stay alive? You know, how what you can imagine what it felt like, if you found them. That's a whole 'nother, um, trauma in and of itself, them dying by suicide and then you finding them or someone you love finding them, a child finding them. That can be something that takes such a long time to heal from. Um, Eric Crow, thoughts of suicide are a go for me after having these thoughts and acts for so long. Well, Eric, I'm very concerned about that. Giving yourself permission to go there. I don't know who else is in your friend circle or your support circle, but I'm sure if you turned to any of them and said, you know, "W I'm sure this wouldn't hurt you," they would look at you and go, "You are wrong." It would hurt me a lot. I would never be able to forget. And you know that the interesting thing that I've noticed too is that when a family member dies by suicide, it is something that almost gives future generations permission to do the same thing. Now, I'm not here touting that we don't have the right to decide whether we live or not, and we can make a philosophical and ethical decision that um, we can end our own lives. That is something that I don't want to necessarily get into a debate about. That's a spiritual matter for a lot of people, and but I know that that's one of the reasons why people die by suicide. Um, some of the others are psychosis, when you actually have a voice telling you to kill yourself. Um, it can be sort of a cry for help, and you think you you're doing something that you are trying to get some attention for how bad you feel, not like a manipulative way, just and then it can go too far. Impulsivity, anger. I think some teenagers especially kill themselves because it's an act of anger. Again, the philosophic distinction. I also think that uh, secrets and the I don't know if y'all remember the Ashley Madison list where it went viral. Who was on this list of people who had paid for sex and or gotten sexual I'm not sure exactly. I think they paid for it. Um, but anyway, there were massive suicides after that of people who couldn't live through the embarrassment of that. Um, Silvana, I wish my uncle did not do that. I miss him so much. You had a okay. Okay, so some of you have definitely been through this and are saying, "I wish this had never happened." Of course you do. I would really like to run away from my own head and body and wish I could just sleep forever. Well, Allison, that sounds like an intense depression, and I don't know if your head is telling you something that you don't want to hear, but depression can be alleviated. Most depressions, some are treatment resistant, but at the same time, you have to tell someone how bad you feel. No one is going to know that if you don't verbalize that, and it's just like you have now, but it's to someone who can help you do something about it. Um, and there are suicide hotlines, which maybe camera right now we should put that list up. And there are local suicide crisis hotlines. You can text. There is a national text number. Um, yeah, text home to 741-741. And so you can get help. Somebody cares on the other end. Someone has volunteered and wants you to know they care about your situation. Mark, we all wear a mask at some point. I remember wearing it only too well. Faking life, not feeling life. The word I used to describe the version of me at that time was invisible. I realize now that by pushing that pain down, it festers and eats you away. I also realize that in illuminating others, do we truly find out how to illuminate ourselves? I'm glad I'm the miracle of my own extraordinary survival. Never ever make the mistake of thinking how you feel now is how you're always going to feel. Big M. What a wonderful comment. That is so true, Mark. Um, I have the distinct honor as a psychologist of most of the time meeting people when they are very demoralized, when they're really depressed, when they're having a lot of panic attacks, when they've had trauma, when their relationship is crumbling, when they've been diagnosed with schizophrenia, when something in their life is really dragging them down. And it's really amazing to see the difference that begins to appear in someone who is moving through their depression, whether that's through meditation or exercise or medication or therapy or some sort of trauma technique. It's, all of a sudden there'll be light in someone's eyes that I have not seen light in their eyes before. They'll notice something in the room and say, "Has that always been there?" And I go, "Yeah, it's always been there." And they'll say, "I just never noticed it before." Because when you're really depressed, your energy is going inward. It's like I call it an implosive disorder because it's all your energy is going, inside of you, and you're, thinking about your own thoughts, and you're lost in your own head. As someone said, "I wish I could run away from my head," because, depression is you've got all this energy going inward, and to push it out and to connect and to engage is something that feels like you don't have the energy to do, and yet you can find it. When uh, you have to try sometimes really hard, and that doesn't mean when you're struggling to find it that you're not working hard enough. It simply means some of the negative thinking, some of the things that you've learned. Depression can be learned too, and certainly, as I just said, the option of suicide can be learned in families because your grandfather died by suicide, or your aunt, or an uncle, or your brother, something like that. Um, okay, so Julie, it's really hard to accept that my doctor decided to do ECT following my serious suicide attempt. I was basically dead. My doctor asked me if I was okay, and I lied to him. I'm not real sure what you mean. Um, okay, so, well, ECT is usually done because the depression is so entrenched that in fact, I have a patient right now who's going through ECT, and it's usually used when there's a time crunch because some of the other techniques that are effective as well take longer than ECT takes. So if he thought that you needed something to really hold on, or she needed something to hold on to, and some quick relief, that's probably why ECT was suggested. Um, I don't quite understand. My doctor asked me if I was okay, and I lied to him. Okay about having the ECT, and I'm sure they had to get your permission. So if you can explain that, that would be helpful. Okay. Okay, someone's trying to help. My father took his life. Thank you, camera. Took his life after a long battle with Parkinson's. They upped some medications 2 weeks prior. Yeah, it can happen with Alzheimer's when you get a diagnosis of Alzheimer's. In fact, Robin Williams had gotten a diagnosis of Lewy bodies, which is a kind of dementia that is really horrible. And many people believe that, that's the reason why he chose to take his own life, because he could not face the idea that he was going to lose his mind, basically, or become demented, or lose the ability to know the people around him and that kind of thing. And the pain of that was intolerable. Plus, he was not all that emotionally stable in the first place. So, um, I don't know if it had anything to do with the medications. It's interesting you bring this up, Jen, because frequently when I've hospitalized someone for depression and maybe even suicidal ideation, and they go into residential treatment for 2, 3, 4 weeks, um, a lot of times you have to be very careful when they come out of that treatment, because not only are they coming back to try to face what they faced that made them so depressed in the first place, but are certainly influential in their depression, but they actually have more energy to kill themselves, mental energy. So you have to be very watchful when someone is on a medication and is struggling with depression too. Um, I'm so sorry. I'm sure that, that's confusing. When you have a parent die by suicide, it's again that question of, was I not important? And of course you were important, but something to him was intolerable. And so, but it's hard to work through those feelings of, again, anger and sadness and abandonment and betrayal and all of those things. So, somebody's talking about the book, What Happened to You. Yes, it's a wonderful book. I don't have, it's on my nightstand. I watched some of the films, the Netflix things, and so that was really really stunning and very powerful. Allison, thank you. I just keep everything to myself and don't want to bother nobody. But some days I deeply cry, explode, and shake with so many tears. My heart beats so fast. I'm hurting so much pain in my body because I've been so physically and mentally hurt. Well, Allison, I don't know where you live or who might be in your community to help you with this, but for example, I just did a seminar with a group called Parents Left Behind, and some of those parents had children who died by suicide. So you can, I'm sure there are Facebook groups that are full of people whose relatives have died by suicide, and it does help to know that you're not alone. Am I the only one facing this? And of course, if you have children or grandchildren who are trying to understand, you're trying to help them. At the same time, you're trying to grieve yourself. Um, okay, Cherise, you're telling us your niece was rushed to the hospital and pronounced dead. My sister dialed 911 for her daughter at 4:20. Okay, I'm so sorry, Cherise. So sorry. Um, okay, so Samantha, I've nearly done it. There's only 6 weeks left. I'm not sure what you're talking about. Camera, can we see if she made a prior comment about what she's been through? Um, you're welcome, Allison. Yes, there should be some more help, but that's why I'm here, and that's why we decided to do this topic, because people can feel so alone. I want to tell y'all a story because I have to get off at 4:15 today, or my time, 4:15, um, so I can run to do something at 4 o'clock. But anyway, there was a woman I worked with many years ago at this point, and she and her sister had been raised in a very abusive home. It was a very religious home, but underneath the surface, in fact, they were sort of minis min what's the word? I'm not ministers. They tried, they were evangelists. They were very evangelistic. And so anyway, and they would stand out on the street corner and talk about, their faith and that kind of thing, which again, that's fine. But the home was very abusive. That was the huge secret. And there were three sisters, and one of them got sort of she did the perfectionism thing, and she tied down the patient that was seeing me. I actually saw all three of them briefly. Um, Took a more practical approach and was a very kind of a very cerebral person. And then the third sister was a huge drug addict. She stole from her family all the time. She would break into their houses and steal money to buy drugs, and she was an alcoholic. But she had a heart. In many ways, she had a heart of gold. And what my patient was telling me, let's call my patient Nan. Nan was telling me that it's when she needed, let's call the other sister that killed herself, Sue. That when she needed Sue, that Sue would sober up and come over, that she just always knew that if she pulled on a rope, as she put it, that Sue would pull back and go, I've got you, because they had this common history. Well, Sue ended taking her own life. And when Nan came into the next session, she looked at me and her eyes were full of tears. And she said, you know, it's like I don't know what to do with the rope. When I pulled it, I always knew Sue would pull back. I don't care how high she was or how drunk she was, she'd always pull back and sober up and come over. Do I keep on holding the rope? Do I put the rope in a drawer? Do I look for somebody else to pick up the other end of the rope? Do I carry it around with me for the rest of my life? What do I do with my end of the rope? And I just thought that was such a poignant um, metaphor for exactly what someone has to learn to do when someone dies by suicide, when someone dies at all, but especially who dies by suicide, because they did something to end their own lives, and either they didn't tell you, or they were again perfect looking, like I've been talking about, and so I think that it's It's something that you have to work through. What you do with what's left, what your memories and your treasuring of that relationship, what do you do with that? And, of course, when in my work with people, I try to help them see that there's a way to put the rope away, but still honor the relationship. Um, Samantha, I'm waiting until the baby inside me is born to go. The father is going to take him, and I can't live with any of that. Gosh, Samantha, that is a horrible place to be, and I would ask you, for one, to get some local help, because uh, when you have that baby, you'll realize, I hope you realize, how much that baby means to you, and that it gives you a whole nother reason. I'm lucky enough to have one child myself, and it can give you a whole nother reason to fight for yourself. I'm not sure, what's going on. The father's going to take him. Sounds like you maybe need some legal advice as well as some treatment and support for what you're going through. Pregnancy in and of itself can be a very uh, emotionally unstable condition. Some people wing it and don't have any problems. Other women really struggle. And so that may be part of what's going on. And so you could talk to your OBGYN about it, but please seek help wherever you are, because I promise you, you don't feel the same after that child is born. Um, and they, they can become such dear gifts and reasons to fight. So I hope you reach out. Oh, great, Jen. Any thoughts how to continue help with my kids after their grandfather died? Also, I'm a mental health therapist. Can you speak at being in mental health and having a parent die by suicide? Sure. Well, kids understand death. It's in age appropriate ways. And so, really, making sure you're not telling them about something, or, you may wait to tell them it was a suicide until you feel like they're emotionally mature enough to handle that. Um, you cannot lie to them. You can say, well, granddad was very sad and his sadness killed him, or something like that, because that's true. But you're also not saying, you're not saying he isn't here anymore because, he's a bad person because he took his own life. So I would look for age appropriate ways to talk about it. And as far as being a mental health professional and having this particular kind of loss, I think that all of us therapists, need to make sure that we understand where our own vulnerabilities are. I'm going to use kind of a silly example, but there was a man who came into therapy with me. Actually, I'd been seeing his wife, and he came in, and I immediately knew that he reminded me so much of my ex-husband, and that had been an abusive relationship for me, that I could not see him. I could not do couples work with them. And, I might have been wrong. I might have overly reacted, but the dynamic was one where I needed to look at my own vulnerabilities, which I did. So, if you can't work with people who are suicidal, or you think you overreact or underreact, then that's when you need to look at your own work and maybe get your own therapy. Um, but I also think, obviously, I've had people not want to work with me when they find out, for example, that I haven't had a child die, and they'll say, "Well, how could you understand?" And the only thing I can look at them and say, "I understand because I've tried to listen very hard to the people that I've worked with." But you're right. There's no way it's the same as actually having the experience yourself. So I think it can be something that people feel comfortable knowing that you've been through such an experience, but realizing that you need to make sure that you're solid with it. This guy happened to come into my practice really not too soon after we'd moved to the city I live in now, and I'd been remarried, but I still had some significant um, lingering issues with the abuse in my marriage, prior marriage. So, I wasn't ready to work with someone like that. So, in any positive way. Um, Katie, oh, are you supposed to learn to self-soothe to overcome ideation eventually, or how do you get out of what seems like an endless cycle? Um, hmm. Well, if it seems like an endless cycle, meaning you sort of move out of it and then you move back to it and you move out of it and then it comes back and you move out of it and comes back. That could be based on a lot of different things. I think you need to have a physical exam to make sure that there's not some medical basis for your mood not staying consistently, I mean, depression doesn't get better like this. It doesn't go from bad to wonderful. It definitely has ups and downs. But if this is what you call an endless cycle, then somehow the work you're doing on your depression you're not getting at the root of it because it will grow back. And so you have to really make sure you're working with a therapist that is helping you understand and do the work around where all that started. It has it it is someone mentioned the book What Has Happened to You, What Happened to You, and um the idea that you have depression like you have cancer or you have, in fact, I just talked to Dr. Caroline Leaf about this morning in an interview. You are depressed, but it's not something that is it's something that was caused by usually trauma or loss, and you have to grieve and work through that trauma. That takes time, and it may be that you're not sticking with that long enough. um, I've had people with chronic suicidal thoughts, and there's all kinds of ways to work with it, and I probably don't have enough time to go into it constantly, very specifically, but um, you have to you don't want to just resign yourself to it. You can accept its presence sometimes. You can say, I worked with someone who had transgenerational trauma, which means trauma that's moved down from generation to generation. He had relatives that had survived the Holocaust, and he constantly dealt with the idea that he could do, he there wasn't any way he could prove his worth. That he was surviving longer than his the generations before him had been able to survive, and he didn't have to go through anything. His life was far more comfortable, and so he felt guilt and shame about that, to the extent that often, although he loved his family devotedly, he struggled with suicidal ideation. So you have to really get at the root of what is going on that can cause this. Well, thank you for the God bless, Allison. I'll take that. Um, I'm here every Wednesday. Oh, not every Wednesday, every third Wednesday of the month. So I'd love to see you back. Now, Camera, you had put another comment up. I lost my ex-boyfriend who I dated for many years to suicide. I'm so sorry, Katie. He remained a significant part of my life, with being one of my dear friends even after our relationship ended. I refer to him as my greatest, deepest love. It's been 4 years and I still can't grasp the guilt that I feel. I'm also a social worker in mental health. I would have done anything to save him. His death is haunting and gut-wrenchingly painful. The guilt of not knowing he was struggling is overwhelming. Well, I'm not trying to sell you a book, I promise. But, he may have been that kind of person who was hiding behind, because he'd learned very expertly how to do that. He didn't want you to see it, and so he knew how for you not to see it, or his parents, or his family, or anyone else. Um, I promise you that can happen. I had another instance. It was May of last year. Two women from Florida reached out to me and said, one of them said, one of my best friends, who I thought I knew like the back of my hand, killed herself, and she was beautiful and successful and had 2 children, and, the community loved her, kinda like the guy I was talking about a few minutes ago. And she very defined she killed herself, she hung herself, and she did it very deliberately. And when I went to the funeral, the husband came up to me and said, "I found this on," her name was Patricia. "I found this on Patricia's nightstand," and it was my book. And so I don't say that to sell you a book. I say that, to say she was looking for answers. And some of the and the answers are not always in the depression classic criteria for, the classic criteria for depression. Your boyfriend or your ex-boyfriend, your bestest, deepest love, might not have ever he might have questioned that, and I couldn't be depressed, but then this despair and loneliness kept growing, and again, he didn't want you to know. Um, Courtney, child abuse is difficult. I don't know how to treat it. No, but there are people who do. There are people who specialize in trauma and in helping you heal, depending on the kind of abuse. There are all kinds of books about healing from childhood abuse. It's a very complicated process. And so, again, I have to go in about 3 or 4 minutes. So I can't go into it now, but it really does mean you digging down and looking for the looking for the root of the problem. And you do know it, but how much have you allowed yourself to talk about it and relate it to others? Yeah, I've told this story here before, but I worked with a woman many years ago who had been sexually abused by her father. And the first session, she told me about that. And then the next session, she said, "I've got something even worse to tell you." And I said, "What is it?" And she said, he made me do it to my brother." Well, the third session, she canceled. And I called her and I said, "I'm a little concerned about you. Let's call her Mary." And she said, "Well, I just feel so much better." And I said, "Well, at least come in one more time." This was at a community health center, so she wasn't paying anything. And she came in and she said, "I thought I knew all along how you if I told somebody what I had done, the impact it would have on them and the look on their face. They would be disgusted with me. They would be horrified at what I had done. And that's not what I saw in your face." So what I had carried around of how people would react to me if I told them that, um, I had done something like that to my brother, been forced to do it, or I had sometimes had consensual sex with my father when I was 18 or 19 years old. There are people who do that because they've been brainwashed. And so, there are all kinds of things that you can be saying, "I'm ashamed of this in my own behavior," because that's what the perpetrator wants. They want you to feel shame because that means you won't tell anybody, and that's how they control you. So one of the ways. So it's obviously it's a tough thing to do, but I'm a huge believer in therapy. I'm a therapist because I got good therapy. Okay, guys, I'm gonna have to leave. Um, One more, Nolan. Hiding behind a happy face and an aura of everything is all right becomes a habit, sometimes one that is inescapable because we perfected the persona, and that's what gets me. I've perfected it so well that I fall apart randomly. Having bipolar, borderline, I get violent at times, but never hurt anyone but myself. I've learned from childhood to play the game. Well, Nolan, I want to tell you that that game can slowly but surely be taken apart. In fact, and it's funny you call it a game because in the book, I talk about the game of Jenga, or when I was a little girl, we played pickup sticks. And you have to, when you're working through something like this with perfectionism, you have to pull out the stick or the Jenga piece where the whole thing won't crumble. And you learn how to take it apart piece by piece by piece by piece so that you can be truly self-accepting of your strengths as well as your vulnerabilities. And the borderline makes it a little more difficult, but it can be done. So thank you all for being here. Thank you, Camera, for being here, being Mental Health on the Mighty's employee that always helps me. And she's wonderful and she's funny and she gives me a lot of support. Um, Courtney, totally get it. So hard to keep it up though in tough times. Yes, it is. Of course it is. Um, my heart is out to all of you who commented. Please seek help. If you found yourself drowning in this, you're so welcome. You're welcome. You're welcome. I get more than I give from all y'all, and so I'll be back next Wednesday. Next month, the third Wednesday of the month, whatever that is. And I will look forward to seeing y'all then. And please take very good care. Bye for now.